Trigger warning: if you're a sensitive person, please kindly scroll past this video. So this video was inspired by a post that I saw on Diary of a Niger Girl's page today. Let's just quickly go through the post together in order to have a context. A lady wrote to me last year.
A sexually transmitted bacteria gotten from her husband has spread to her uterus. While apologizing, her husband said, STI no longer kills people. There is always a way to manage it. She didn't want me to post. She just needed someone to rant to. Checking my DM now, I see that this lady's sister wrote to me 2 weeks ago. She had passed on from complications from pelvic inflammatory disease. The bacteria spread from the vagina to the ovaries, the fallopian tubes, and the womb. Sigh. The entire Renata girl goes, those of you who stay with habitual cheating partners, don't you like your life?
So guys, let's really talk about pelvic inflammatory disease, which is caused by sexually transmitted infection.
And there are 3 types of organisms that are notorious for causing pelvic inflammatory disease. The first one is chlamydia, the second one is gonorrhea, the third one is mycoplasma, and others.
So how do women contract chlamydia, gonorrhea, or mycoplasma? Basically through unprotected sex. So if they have unprotected sex with a man who is a sitting duck for chlamydia, gonorrhea, and mycoplasma infection,
the bacteria basically swims through the neck of their womb and starts causing chaos right from there. Causes inflammation of the neck of their womb, goes through the womb, causes inflammation there, inflames the inner lining of the fallopian tubes, the ovaries, and then spills into the abdomen and starts causing chaos there as well. So what symptoms will a woman who has PID present with? Before I start, allow me to reiterate that some women don't even have symptoms at all. But some of the symptoms that a woman who has PID
will present with is abdominal pain,
greenish yellow, foul-smelling vaginal discharge. Third one is painful sexual intercourse on deep penetration. That is caused by when the phallus hits the neck of the womb, which is already inflamed. Fever, nausea and vomiting, painful menstrual period, discomfort whilst passing urine. And then what are the complications of PID if it's not managed adequately?
Infertility, ectopic pregnancy. One of the serious complications of PID is what is called tubal ovarian abscess. Basically, this is when pus collection forms all around the pelvis. What is the gold standard of treatment for tubal ovarian abscess? It is not just antibiotics, it is surgery where they drain all those pus collection. Now, the treatment of PID varies. It's different in a pregnant female as compared to a non-pregnant female. Now, how can someone die from tubal ovarian abscess, or how can they die from complications of PID? If a woman has ectopic pregnancy which is not properly managed, if a woman has tubal ovarian abscess which is not properly managed, the woman can now go on to have sepsis. Sepsis is your body response to severe infection, which can lead to multiple organ failure. Your kidneys, your liver, your brain, everything fails. You suffer a cardiac arrest and you simply die from it. Now, with all of this being said, do you think a woman should stay with a cheating partner? Can you let me know?